injury 15 years prior. During that period, the patient underwent over 20 reconstructive procedures, including multiple free tissue transfers. On March 19, 2012, Dr. Eduardo Rodriguez led a team of 5 surgeons from the University of Maryland R. Adams Cowley Shock Trauma Center in a full-face transplant. The procedure transplanted the mid-face bony anatomy, mandible bony anatomy, teeth, tongue, facial muscles, and soft tissue from a donor to the recipient patient. Surgeons performed surgical dissection of the recipient patient and donor patient simultaneously in 2 separate operating rooms. The skin incision began at the hairline and proceeded inferiorly, while staying anterior to the ears and down to the level of the neck above the clavicles. Bilateral periorbital incisions were performed, preserving the recipient patient's eyelids. Following the skin retraction, the arteries and veins were identified and tagged with corresponding color-coded vessel loops. Internal jugular vein with a thyrolingual facial trunk, lingual vein, facial vein, external carotid artery, lingual artery, facial artery, and internal maxillary artery. The identification of nerves was performed, including the buccal and mandibular branches of the facial nerve. At the donor patient, the tongue was harvested with a perimeter incision for transplantation to the recipient. Preoperative planning using Synthase ProPlan CMF allowed for the exact location of the bony anatomy cuts to be planned. The planning ensured accurate alignment of the donor bone on the recipient defect. Cutting was performed on the recipient using Synthase ProPlan CMF patient-specific surgical guides. On the donor patient, cutting guidance was assisted with the use of intraoperative navigation. First, the mandibular guide was attached on the recipient mandible. A mandibular bilateral sagittal split was performed at the margins indicated by the guide. Next, the maxillary cuts were performed. A Lefort 3 osteotomy was performed using Synthase ProPlan CMF surgical guides. Removal of the midface was finalized with an osteotome. To minimize ischemia time, the donor bone was harvested while the tissue was being perfused. The accuracy of the cuts was checked using a sterilizable Synthase ProPlan CMF bone model of the recipient defect. Fine adjustments using a burr were made, and the donor portion of the bone was plated using Synthase Matrix midface plates and screws. Blood vessels were ligated and divided. Then, bone, teeth, the tongue, soft tissue, and muscles of facial expression were transferred to the recipient operating room. Following the bone plating at the midface, the blood supply was reestablished. On the right side, the donor external carotid artery is anastomosed to the recipient internal maxillary artery end to end, avoiding the trunk of the facial and lingual arteries to ensure adequate vascularity to the tongue. Next, the right donor internal jugular vein is anastomosed end to side to a branch of the right recipient internal jugular vein. Anastomosis of the patient left side followed in a similar manner. The donor mandible was then fixated to the recipient mandible using 4 Synthase Matrix mandible screws bilaterally. Intraoral repair was performed posterior to the mandibular molars and continued superiorly to the junction between the hard palate of the donor and the soft palate of the recipient. The tongue was transplanted circumferentially at the tongue's base. Next, the nerve coaptation was performed. The 2 branches of the buccal nerve were connected on either side of the upper lip and lip commissure. Additionally, 2 branches of the marginal mandibular facial nerve were connected, resulting in a total of 4 motor nerve branches reconnected on each side. Finally, the skin was tailored and the soft tissue sutures were made to close the procedure. Accurate alignment of the patient's bone using Synthase ProPlan CMF ensured that the height, width, and projection of the facial anatomy were restored as planned preoperatively. With the bone as an underlying foundation for the soft tissue drape, the final outcome resulted in a dramatic improvement for the recipient patient.